you for joining consumer-driven healthcare, consumer-driven health insurance premium segment. This is Consumers Doctor on behalf of foremost organizations. Today's topic is Personalize health insurance, a private market solution. All of you guys know that President Biden will be taking charge, and is going to go with top down, one size fits all, premium based, general risk solution. Overall, there's no segmentation, there's general risk. So today I'm going to talk about personalized health insurance. Personalized health insurance, so-called, is a hassle-free idea that focuses on the importance of health insurance affordability and choice. It does not mandate, or it doesn't have any plan design. This personalized health insurance premium, so-called consumer-driven health insurance premium, the premiums will be lower by 15 to 20%, folks. 15 to 20%. Let's talk a little more in detail, because before we jump into this one size fits all, Medicare for all approach, let's explore what is this about private market solution. I want you guys to seriously think about it and give a thought and see how this works. Let's explore it. Consumer-driven health insurance is a private market solution. It's a consumer-driven. It's personalized. Its strength is that it provides unique solutions depending upon your health profile, where you get your health insurance, either from the employer or a personal purchase. Let me explain that. Let's assume you and I are over 200 million Americans, which we all fit in one of the four categories. One is a large employer-sponsored plans. That's number one, large employer-sponsored plan. Number two, small employer-sponsored plan. And number three, individual purchased health insurance. And number four, uninsured. So we fit in one of these. Out of those 200, we fit in one of these categories. Let's dig deeper and find out which category you are in. If you are in a group plan, like large or small employer group, it may be self-insured or fully insured plan. If you are in the group, maybe self-insured, or it could be fully insured, traditional insurance I'm talking about. If you're uncertain, ask someone in the human resource in those small and large group purchases. It's not a secret, folks. They will tell you it's not a secret. If you can't reach human resource department right now, check with them later. Generally, if your company has fewer than 50 employees, it is fully insured, like a traditional insurance, fully insured. If you have more than 300 employees, you're probably are self-insured by the company. Self-insured is by the company. Whereas traditional insurance is you like a smaller groups, they go and purchase it from the insurance carriers. Try to answer these questions. Follow, try to answer these questions. Number one, do you work for a large insurer, large self-insured employer? You work for a large self-insured employer. These companies provide employer subsidized health plan to over 120 million employees and the family members. 120 million folks. These large employers. It's a self-insured group health plan. Employer pays the claims. Employer pays the claims. And uses administrator as an insurance company to manage claims and other services like legal, actuarial, educational, and enrollment. All those things are internal by a large employer. These employers, the employer is at risk and is responsible for paying any claims. These large employers, because they are self-insured and they are responsible for any claims. Employees through the staff service, working with the human resource department, can have a big impact on the coverages and the cost of the insurance. The self-insured insurance. And number two, do you work for a small insured employer? If you're working for a small insured employer, these companies provide employer subsidized health plans to about 45 million employees and their family members. A fully insured traditional health plan is one of which employer pays a fixed premium to an insurance carrier for a payment of claims and all other services. So there's a fixed payment from the employer. So you pay a premium for that policy. And insurer is here, insurance company is at risk and is responsible for paying the claims. In a small company, individual voices and concerns are more likely to be heard. Talk to your benefit manager about options and alternatives. You can talk to in your company whoever is providing your health insurance. And number three, if you have an individual policy because you're self-employed or your employer does not have health insurance, about 15 million of those members have individual policies. Again, this is a traditional insurance. In 2019, 11.4 million people purchased individual policies through federal insurance exchanges. 11.4 so-called government structure set up under Obamacare. So 11.4 million people purchased the insurance under the Obamacare. Another 3.6 million purchased insurance directly from the insurance companies, insurers. So 11.6 got enrolled into the Obamacare. And these are the individual policies, folks. If you need an insurance now, talk to an insurance agent. Explain your family needs, budget, and health concerns. If you want changes to what you should be available, other insurance reforms, Let's move on. Let's move on. And number four, you're one of those individuals who have no insurance. You're uninsured. This is the fourth category. You're uninsured. Estimated 28 million are uninsured, were uninsured in 2019. Some uninsured are jobs, between jobs and can't afford so-called COBRA, a temporary continuation of coverage. Majority of the uninsured are the working poor. These are the working poor without access to the employer subsidized health insurance. If only affordable insurance, if the insurance was affordable, was available to meet their unique needs, because they couldn't afford, they are uninsured. Reflect. Reflect on the reason you're uninsured. If you are between jobs, COBRA continuation of coverage may be the answer. A temporary 6-month catastrophic plan may meet your needs. For a long term coverage, you need to see an insurance agent. And a price for a plan that meets your budget. That's where the insurance agent comes in. So we will discuss the political reforms and your involvement and vote. Now we have already elected President Biden. We will see what he does. There's an old saying, folks, legislation tends to crowd out the future. Legislation tends to crowd out the future. It means once the government gets control, it is really hard to change or modernize programs. That is why I've been explaining clearly what is good for the customer, what is good for, you know, when you bring down one size fits all, top down government, basically they are looking for the power, guys, power. They want to control you. You know, Abraham Lincoln said the best. I always bring up Abraham Lincoln because this country can never be invaded from outside. You know why? Because of the freedom. Yes, because of the freedom. Even if you falter on freedom, we will be invaded from outside if we falter. This healthcare, they've been talking about Obamacare healthcare. It is not about healthcare, folks. You guys are mistaken. It is all about control. Control. The more enrollees they have in the government control, more democratic votes. This is what it is. But you lose your independence. You lose the independence. There are examples. We already have the examples of government control programs because all these people work for the government and the cities, they always vote Democratic. This is what it is. Medicare. Medicare is a government program. Government insurance for over 65 and older is running out of money. What is new? Medicare is running out of money. Baby boomers are overwhelming the Medicare system, folks. And the coverage is so inadequate that that many have to purchase expensive Medicare supplemental programs. People who have personalized health insurance are way ahead of this. So Medicare is going to be insolvent, especially the baby boomers enrolling into the Medicare. They have no funds. And Medicare is bureaucratic, so-called this billing system is so chaotic. And we want that billing system. People are filing bankruptcies because they're not able to pay the bills. With modern technology we have, do we really need a billing? This codes, so-called CPT, DRG codes and payments are made up numbers, folks. They're not consumer-driven numbers. These are made-up numbers. Only consumers will lower the cost. If you are consumer-driven, they will demand affordable. They will demand transparency. They will demand pay as you go. So that way they don't have to be bothered. So this is one of the Medicare is a government program. And second one is Medicaid, government insurance for the poor, is draining federal and state budgets, is fraught with fraud. Payments to care providers is so low that many doctors do not accept. As I mentioned to you earlier, I have seen roughly around 25 to 30 patients bill the Medicaid. They had the audacity to send me a check for 1 cent. How would I feel to take? I would love to take care of the poor, but it's insulting if they send me a check for 1 cent. That's what Medicaid. This is my experience on Medicaid. I should have framed that check. You may have a Medicaid insurance card, but access to care is limited, folks. You don't get it. And these people need the most attention and they're being neglected under Medicaid because you're not getting the right focus. The next one, Veterans Health, has long waiting lines and inadequate care. This is another government program. TRICARE is so-called for military health, and CHIP, so-called Children's Health Insurance Program. This is also a government program. All need reform and added flexibilities to improve the coverage and patient care. They all need to be reformed because these are all under the umbrella of the government. Well, we'll see what President Biden does. Solutions to government control programs are difficult because significant lobbying interests and resistance from the special interest constituents. Too often, comprehensive solutions include these programs, so-called comprehensive. That's actually a kiss of death. When they say comprehensive, that's a kiss of death for any proposal when they talk about comprehensive. Those reforms, so-called, typically decried as hurting the poor, throwing the grandmother over the cliff. Let's set these issues aside for separate actions and focus on 200 million Americans getting a health insurance in the market. Let's explore that. Let's talk about, let's not dwell on the government sponsored programs. If you have an insurance agent, if you have an insurance agent, Let's discuss what the reform needs. Large employer sponsored plans. Reform, yes. For major solutions are, what is the definition of a large employer, large full-time employees, price transparency, quality measures in the large employer. That's what we need. We need those reforms. What do we need for the smaller group sponsored plans? As far as the reforms are concerned, guaranteed issue, pre-existing conditions, coverage of the pre-existing conditions, eliminate single risk pool. This is where we talk about risk pool needs to be segmented, and affordability is so critical in the smaller employer group. How about the individual policies? We need reforms in the individual policy. Guaranteed issue of the coverage and pre-existing conditions choice, affordability, impaired health support group reforms, and eliminate the single risk pool. Eliminate the single risk pool. This is where we are hurting. We need to segment it to different categories, like well category, at risk for acute conditions, chronic illnesses, and catastrophic. We need to categorize. We need to segment them. How about the uninsured? Yes, we need reforms in uninsured. They need guaranteed coverage for pre-existing conditions and affordability and impaired health. And these are the people who need the most attention. And they need to have a certificate of guaranteed coverage by the Health Review Authority, which is a public-private partnership, folks. It's a public-private partnership. It's not the government and the private. They work together to provide the coverage for the uninsured, and they're guaranteed the coverage. How about Medicaid? We can't. It's already bureaucratic. I don't think Medicaid grants, block grants to state. Medicaid needs elimination of waste, fraud, abuse, and work requirements, and long term. These need to be eliminated, folks. Medicaid needs elimination, total elimination. Medicare, another government program, needs to be eliminated. So called Medicare Advantage is nothing but an intermediary. Fraud, prescription drug costs are not transparent, and federal budget keeps rising because of the Medicare expense keeps going up. We don't have the money. They keep on printing the currency. So Medicare is going to be insolvent. So that needs to be, we need to have a different system than what we have, folks. We need a personalized, consumer-driven healthcare. TRICARE, VA, and CHIP. There are some flexible and private options. By focusing on public-private partnership, we will be able to provide personalized health insurance, which is consumer-driven healthcare, consumer-driven health premiums, transparent. Consumers demand transparency. Consumers demand lower premiums. Consumers demand transparency in the cost of the care. Consumers need to be in control. They have the only one lower the cost of the healthcare. I need I can't emphasize you more than anything else, because look at the consumers, what they have done to the retail industry. Look at what they have done to the food industry, agriculture, consumer demands. So what is the difference between food and health? I don't see any difference. When you can when you can provide the same regulations for the food, so-called safety standards, it is the same safety standards in healthcare. Why it has to be different? I don't see any difference when you can provide. We are the leaders in delivering affordable groceries, affordable premiums right to the front of your door with Amazon. They deliver. Walmart, they're delivering because consumers are demanding it. That beauty about consumer demands, they will demand lowest cost, which public private partnerships can provide. That's the only solution, folks. Whatever you call one size fits all, government top down, will never work. And Americans will never go for it. The bottom up approach, where consumers need to awaken up, they will demand freedom in healthcare. I am betting you, consumers will demand freedom in healthcare. There's no other there's no other choice, folks. I'm telling you. This is the way healthcare is going to be. If you do like this channel, subscribe, share, and hit that bell. Thank you for joining Consumer Driven Healthcare and Consumer Driven Health Insurance segment by Consumer's Doctor, who is a customer's doctor on the behalf of the foremost organization. We will see you in the next episode. Thank you. Salute.